My name is Charles Nduka. I'm a consultant plastic surgeon at the McIndoe Centre. Sometimes it can be difficult to recognise when a person needs a brow lift or an eye lift. With a brow lift, the distance between the pupil to the top of the brow is typically less than 20 millimetres. If that's the case, then maybe a brow lift is the better operation. Alternatively, an eyelid surgery can be done to lift the brow at the same time, and that gives a much more aesthetic, much more harmonious result. Eyelid surgery is the most common operation I perform, and people often ask about the recovery period and is it painful? Well, the good news is that patients often have 2 paracetamol after surgery and thereafter no more. It's not a painful operation, although sometimes the bruising can be present for about a week or so. The operation is done under local anaesthetic as a walk-in, walk-out procedure. Patients have some cream put on to make the skin less sensitive for the injection. The injection takes a minute or 2 to be numb, like a dental injection, and thereafter the operation is totally pain-free. Patients can expect to go back to work typically after a week or so. Maybe they need to put some makeup on, which can happen straight after the sutures come out, and then they can expect to go back to their normal activities thereafter. Sports and things may be a bit longer because otherwise you'll get swelling, which can cause the result to not be as optimum. What's the one thing you do every day that has a negative impact on your future appearance? It's sleeping on your side. When you lie on one side predominantly all night, that's 1/3 of your life, essentially 8 hours if you sleep all day. That causes pressure from the pillow, pushing down on your brow, stretching the soft tissues, and eventually causing the brow to droop on one side more than the other. Now eventually that causes the skin to seem loose on the outer part of the brow, and many patients complain that they can't apply makeup, it's difficult to see from the outer part of the visual field, and it means the surgeon needs to be both aware of this and to address both sides appropriately to avoid post-operative asymmetry.